Good morning, my name is Tserotas, and I will be demonstrating a central line dressing change. And so first you want to gather your supplies, and what I've got here is the central line dressing change kit, a cap because we're going to do a cap change. We're also going to flush with saline, and then we've got our heparin bottle here to flush at the end and to instill that into our lumen to help prevent any clotting or occlusion of the line. So those are my supplies. And I also have plenty of alcohol pads here as well. And so with the central line, you always want to verify your order before you do any sort of skill. And with a central line, it's not really a specific physician order. It's a protocol for your hospital, so it's a standing order anytime a patient has a central line. So usually they're done, on a schedule, like maybe every Tuesdays or every Thursdays. And then it's also under your purview as a nurse that anytime your dressing may be soiled or loosened, that you can change it then as well. So we're just going to go in as a normal routine dressing change. So I've got my supplies. I brought that into the room. And now I'm going to talk to my patient here. Hi, Mr. Kelly. My name is Shopa. I'll be your nurse today. And I just want to verify your name and date of birth. Sam Kelly, great. And your date of birth, great. And you're not allergic to anything. Wonderful. Well, today we're going to do a dressing change on your central line, and that's that IV that's right here in your chest. And we're going to change that to help prevent any infection, to make sure that your line is intact and everything's working properly. Okay? So first I'm going to do some hand hygiene. I'm going to put some clean gloves on first. And we're going to inspect Mr. Kelly's central line. So the first thing you always want to do is assess this site. Now right here, Mr. Kelly has what's called a single lumen central line. And here's our clamp. You will see some central lines will have 1, 2 of these lumens, or may have 1, 2, 3 lumens. And so if they do have multiple lumens, usually the ends will be different colors, so you can identify which one that you routinely maybe draw blood from, or the patient's receiving TPN, which is a form of nutrition given IV, or maybe blood, or any other sort of IV fluids. So they would be usually different colors. And so here Mr. Kelly just has a single line, single lumen central line, and I know it's maybe a little bit hard to tell, but you can see there is a clear occlusive dressing around the site that keeps it in place and keeps it nice and clean and sterile. And so it looks good, but according to our protocol, we need to go ahead and change that today. And I'm looking at the skin. Everything looks really good. Looks like it's intact. There's no excoriation, no swelling, no erythema. Do you have any pain at this site, Mr. Kelly? No? Okay, good. I don't see any drainage coming out of the insertion site. So these are all good things. Okay? And so in order, before I take this off, I want to be able to put a mask on Mr. Kelly and myself. And I'm going to obtain that mask here from my central line dressing kit. Now remember, your central lines dressings are done with sterile technique, and it's very important to do it sterile technique because there are a high rate of infection with central lines. And so we want to be very careful when we do our dressing change to maintain that sterility. And so that's my trash right there. So I'm going to put a mask on Mr. Kelly. Mr. Kelly, we're putting this mask on because we want to help prevent infection, and we don't want you to breathe right on that site. Let's say Mr. Kelly said, no way, I'm not wearing this mask, I'm short of breath, or I'm getting anxious and I can't tolerate this mask. You can kind of coach your patient, let them know, just relax, it won't take very long. I promise we'll go as fast as we can, but it's going to help prevent infection. If he's still insistent, that's all right. We're going to work with what our patient's got, and we're going to tell him, okay, you don't want to wear the mask, so you're going to have to turn your head completely away from the site, and you're going to have maybe an assistant or maybe a family member on this side making sure that their head is kept turned away from that side the entire time. But Mr. Kelly's great, and he wants to be compliant, and he's going to keep his mask on. So if Mr. Kelly wears a mask, we're going to have to wear a mask too. So both of us will be wearing a mask. And then at this point, I will be getting my garbage can here set up. And I'm going to go ahead and take the old dressing off. And the nice thing about these dressings, being called either a tegaderm or an opsite, is that they're meant to stretch. And when they stretch like that, they're not meant to be peeled off like a band-aid. They're meant to stretch, and it's meant to be removed outward towards the middle, and it's meant to be stretched so that you're not peeling off the patient's skin, and it's a lot more comfortable for the patient as well. And we want to be very careful once we get to that site. Some of these central lines are sutured in, and they'll have like a little triangle type of piece right here, and it'll be sutured into the skin. This one is not. So we have to be especially careful that we don't inadvertently remove this line. So at this point, I'm going to be very careful here. I'm going to hold down my line. I'm just going to work my way around. Talk to Mr. Kelly a little bit. Ask him about his day. Make sure everything's going all right. Talk to him about my goals for the day with him and what his goals are. And so now that we've worked through this line, I'm going to stabilize this line. So you can see that there's an insertion point right there. And that insertion point, if there's anything draining at this point, I would get a wound culture. So you'd want to get a culture of any fluids, you know, any drainage, pus, or anything that's coming out of that insertion site. And at this point, you know, you don't want to leave the patient with this open like that. So you'd want to, you know, call for help and get somebody to bring in your supplies to get a wound culture real quick. And then, you know, you'll need to let the doctor know about that you sent that wound culture, and, you know, get your dressing done as well to get that covered up again until you have any further orders. But if you see anything going on like that, you definitely want to make sure you address that with the physician. Okay, but he looks really good today, so that's great. And at this point, I'm going to take my old gloves off, and I'm going to set up my sterile field here. Put my sterile gloves on. I have a feeling that wants to flip back on me, but maybe it won't. Okay, so I'm going to get my first glove on here, touching only this part. I'm going to step back, get my glove on. I'm going to go on this side, go on that cuff, inside of the cuff. Step back. Now I can come back here inside of the cuff, and I'm good to go. Waist high. I'm going to let that drop. Now I'm going to set up my sterile field here. Shiny side down. Sterile, good. I've got a ChlorPrep that I need to open, and the ChlorPrep is your antiseptic that you'll be using to clean the skin. Then I've got some tape. I've got my tegaderm. I'm going to measure. I've got some forceps. I've got little gauze if I need it. And I've got a SurePrep, which helps to prepare the skin and protect it. And then we've got iodine here, but I'm actually not going to use that. That's not really a recommendation anymore at this time, so I'd avoid any ointment unless it's ordered. Okay, so first I'm going to get my ChlorPrep here, and you're going to squeeze these two handles together, and you might have noticed that there is a liquid that came down. Once you crack that, I'm going to invert that, let that get a little saturated, and you'll see that it's saturated at this point. And so at this point, I'm going to be going in a back and forth motion. I'm going to make sure I get that site right at that insertion site. And you want to scrub back and forth. Okay, so you want to go at least 2 to 3 inches around. Then I could take the side and I'll clean down that way, and then that's my trash. Okay, so I'm gonna put that in the trash, and then at this point I can use my Sure Prep. So I'm going to use my Sure Prep here, and that's going to help protect the skin. So I'm going to use that all around, let that dry for a second, put that in the trash. And at this point, if your facility has what's called a bio patch, you would have, it's a circular disc that has a fenestration. You could take your forceps, pick that up, and you would place the bio patch right here, and it would sit right there at that insertion site. It's just a small disc, and it would sit there because it has an antimicrobial effect and helps prevent central line infections. Okay, and so at this point, because it's a mannequin, I'm going to dry this off. Do not dry off your patient with the gauze, but if I don't dry this off with the gauze for a mannequin, it won't stick. Okay, so now I'm going to get my Tegaderm dressing. I'm going to place it over the site enough so that this is well protected and that my line is secure. And then I'm going to peel my Tegaderm off. Excuse me, the tape for the Tegaderm off. I'm going to peel off this side. And then you see there's a date, time, and initials that we've got to do as well. So we're going to do that also. That's a little tape there, that's alright. So now I'm really done with the sterile part. I'm going to take my pen out, date, time, and initial. I'm going to put that kind of just over the bottom so I'm not covering up the site. And now I can measure. So you want to measure from the insertion point out, and you want to document that measurement. So let's say right here, go all the way down. This one's pretty long. I wouldn't say it's usually this long, but we've got about 33 centimeters, and you want to do that in centimeters, of course. Alright, so now we're done really with the sterile portion, with the actual dressing change. Now with each dressing change, you'll also want to change the cap, and this is your cap right here, and you want to do that to help prevent infection, to keep it clean. Okay, so that's an easy part. You'll want to get out alcohol pads and open this up. In its package, I'm just going to loosen the end of that. That end needs to stay sterile, so I'm just going to keep it loosened right there. Then I'm going to take an alcohol pad and I'm going to remove this cap right here. So this is the actual central line, this is a cap. And I'm going to clean the outside, the top, and all around. Okay. Then I'm going to get my new cap. And this one you can just get, since I loosened that, that worked well. And I'm going to turn that new cap on. And that's it. That's your cap change. So that's very easy. And now we're going to flush our line. We want to flush our line to make sure that it's working properly and to heparinize it in order to prevent clotting and occlusion of the line. So I'm going to get some alcohol pads. And here, let's say this is our pre-filled normal saline flush right there. Okay, so that's our pre-filled flush. Then I am going to use heparin. Heparin comes in a lot of different concentrations. For infants, it can be given IV, it can be given sub-Q, so you want to make sure it's a heparin lock flush and it's the appropriate concentration for your patient. Okay, And anytime a patient is actually on any sort of heparin, even as a heparin lock flush, you want to make sure that you're looking for signs and symptoms of what's called HIT syndrome, which is heparin-induced thrombocytopenia. So you need to monitor lab work and notice any signs of bleeding. Okay? So right now I'm going to wipe off my heparin. I'm going to open my syringe. And when you use the central line, we generally use 10 cc syringes, has been the recommendation. So even if you're giving a 3 ml amount, you're going to be using a 10 cc syringe. And here is your blunt cap there. I'm going to draw back 3 mils of air. Insert it in here. Invert. Now draw back my 3. Tap it out. Okay, I'm just going to draw back some air, have the bubbles kind of float up. When you get the air at the top, they kind of float up. So now I'm going to push the rest of my air out, and there's a little surprise for us. That's okay. And then I'm going to switch sides here on this twin pack. I'm going to put my blunt side on here. Okay. Actually, I'll keep that cap on until I'm ready. Alright, so now we're going to flush. And if I had a triple lumen line, I'd have to bring 3 separate flushes. A saline, 3 saline and 3 heparin. Also, that goes with the cap change as well. If there's 3 lumens, I need 3 caps. Okay? But since we have a single lumen, we'll work it with this. So let's always scrub our hub. And first we're going to use the normal saline. I'm going to turn that on. I'm going to unclamp. I am going to pull back and aspirate. Now what that does is when I aspirate and I pull back, blood should show here in my syringe. Some of these, sometimes they'll be clear and so you can see the blood coming back, but it should be in my syringe. That lets me know I'm in the right place, that this should actually be in the superior vena cava. Okay, so it's telling me it's in the right place. So let's say I have blood return, then I'm going to flush this entire 10 cc's, and I'm going to give that over maybe 30 seconds to a minute. Okay, so you're going to give the whole thing. I'm going to clamp it off, take that out. I'm going to scrub my hub again. Now I'm going to get my heparin. Now if I were ever to leave the room or anything, this would need to be labeled. But since I've been in here the whole time and I have drawn from here, then I don't need to label it right now. Now I'm going to take this part off. I've scrubbed my hub. This is my heparin. I'm going to turn the heparin on. I'm going to unclamp. And I'm going to instill this heparin, over maybe 30 seconds or so. So the heparin, what it does is it stays in the line and it helps prevent clotting or occlusion of that line. At the very end of that, right there, I'm going to clamp it off for positive pressure to maintain in the line. And then I'm going to get rid of all my supplies. And this is a really long catheter, so I'd probably tape that up. Let's just tape it up. They're not always this long, but if you ever find that you have one that's long, feel free to tape that up so it remains secure and doesn't come out. Okay. All right, Mr. Kelly, well, we're done with your dressing change. Thank you for being patient and wearing this mask. I know that wasn't fun, but we appreciate it. And we've done your dressing change here, so thank you. Let me make sure you have your call light. Your call light's here. Is there anything else I can do for you? Okay, great. Put your bed down here for you. I'm going to get rid of all my supplies, throw that in the trash, throw that blunt cannula in the sharps. And now we're going to talk about documentation. So let's talk about our nursing note here. We've got the location of the actual central line. So it's a single lumen right chest central venous access device site. The dressing was removed. The skin is intact with no erythema, swelling, or drainage. The dressing change was completed with sterile technique. The end caps were changed. The lumen was positive for blood return. So remember, I talked to you have to have blood return in order to use it properly. Flushed with saline and heparinized. Patient denies pain at site. Educated patient to inform the nurse of any discomfort, drainage, or swelling. Patient verbalized understanding. Patient tolerated the procedure well, and the call light is within reach. And then I've got my date, time, and initials. All right? Okay, that's your central line dressing change.